My name is Allison Prescott. I'm going to be your nurse for today. How are you doing?
Doing well. How are you?
I'm doing pretty good. Thanks for asking. So we're here to do a head-to-toe assessment. It's going to be a little bit lengthy, but I'll try to make it as quick and as comfortable. So let me know if you have any sort of pain or you are uncomfortable through it all. I'm going to wash my hands, perform hand hygiene, and then put on clean, sterile gloves. Then I'm going to perform patient privacy by pulling the curtain closed. Before this moment, I would have already have taken her vital signs, her height, her weight. I would have calculated her BMI and tested her vision with the Snellen chart to test cranial nerve number 2. So after I have done all of that, I'm going to start by inspecting her head. So I'm going to look at it, and is this your normal skin color?
Yes, it is.
Awesome. So her skin color is evenly distributed. There's no signs of lesions or abnormal spots of coloration. Her temperature is warm. Her face is dry. And she has a septum piercing in her nose. So then I'm going to come around and palpate your hair. And is this your normal hair color?
It is not.
And I'm not feeling any sort of lumps or masses. And is there any sort of pain?
No.
Awesome. So she has pink hair, but it's an abnormal color. What is your normal hair color?
That's usually like a light brunette, dirty blondish type color.
Awesome. So her level of consciousness is she's upright and alert. She's able to respond to outdoor stimuli. She's sitting upright in a good posture. She's not hunched over. She's not showing any signs of guarding or abnormal body movements. Her face has a flat effect, not really showing any pain or enjoyment, which is appropriate for situation. Her hygiene, she's clean. There's no odor. She doesn't have any signs of uncleanliness. She's well kept. Her speech is clear from the moments that she had been speaking earlier today. And her mood seems pretty normal. Like she's in a good mood for being at the doctor's office. So then after I inspect and palpate her scalp, I'm going to see that her face is symmetrical. There's no sorts of abnormalities. So then I'm going to move to palpating her sinuses. So let me know does that hurt at all?
Does not.
Awesome. No pain in her sinuses, and that's good. So now I'm going to be feeling the sides of your mouth. Will you open for me? And close. Open. And close. And clench your teeth. Awesome. And that's to test cranial nerve number 5. Was there any pain with that? No? So no tenderness, no swelling, no crepitus, and no limitations to movement. So then after inspecting her overall head, I'm going to then move to her eyes. So I'm first going to inspect, and I'm going to be looking at her sclera, which is white, her cornea, which doesn't look like there's any sort of tears or lesions. I'm going to be looking at her premolar fissure, which is open and doesn't look like there's any sort of irritation or lesions. Her eyelids are intact with no lesions. Her lacrimal gland is intact, and there's no sorts of drainage or signs of infection. And that looks good. So then now I'm going to palpate your nasolacrimal gland. So do you feel any sort of tenderness when I press?
I do not.
Awesome. So no tenderness, and there's no signs of drainage. So then I'm going to move to her ears after I test her pupils. So I'm going to use my pen light, and I'm going to shine a light into your pupils to check your pupil, your dilation. So if you would just look straight at me. And both pupils constricted with roundness and symmetry when exposed to direct light. So now I'm going to check to make sure that your other pupil will indirectly react. Perfect. So her pupils constrict when they have indirect light to the other pupil. So then now that is to test cranial nerves number 2 and 3. So now if you would just focus on this, and I'm going to move it closer to your face. Awesome. And that's to test for accommodation, and that tests for cranial nerves 3, 4, and 6. So now if you would, again, look at this, and I'm going to move it around. You just keep your eyes. Perfect. And that's to test her ocular movements and to test for cranial nerves numbers 3, 4, and 6. And those were normal. There was no sort of limitations. And was there any pain associated? No? Nope. Awesome. So after her eyes, now I'm going to move to her ears. And first I'm going to just inspect them and look and see that the coloration is normal for her skin tone. There's no sorts of inflammation or swelling, so I'm inspecting her auricle, tragus, and lobule. And there's no sort of drainage or lesions on those. So then I'm going to palpate the pinea. Is there any pain? Nope. The tragus and the mastoid. Any pain? No pain. So there's no tenderness, there's no edema or swelling or abnormalities. So now I'm going to use my pen light, but I would be using an otoscope. So I'm going to look inside your ears to look at your cerumen. So looking inside, I can look for any no lesions, no nodules. Your cerumen, or earwax, is a good orangey, yellowish color with a waxy consistency. Your tympanic membrane is a pearly gray, and it is intact. And there's no sorts of drainage. I'm going to come around to the other side. I'm going to pull up and pull back. Look inside, and the same thing. There's no lesions, no nodules present. No signs of irritation or inflammation. Her cerumen is a yellow, orangey, waxy color with a wax consistency. Her tympanic membrane is a gray pearl, and it is intact. So that's good. So then now I'm going to whisper a few words behind you, and if you could tell me exactly what I say, that'd be great. Horse. Boat. Paradise. Other side. Hair. Shoe. Doorknob. Awesome. And that's to test cranial nerve number 8 for her hearing. And that's intact and good. So after her ears, I'm going to go ahead and move to her nose. So first I'm going to inspect it, and her coloration is normal for her skin tone. It's placed center on her face, and there's no sorts of deviations or abnormalities of the shape of it, and the consistency is good. So now I'm going to go ahead and palpate your nose, so tell me if you have any pain. Okay. Anything? No? No. And like I said earlier today, she does have a septum piercing, so to take note of that. So then now I'm going to look inside your nose. I would be using an otoscope. So I'm looking inside. I can see that her nose inside is a healthy pink color, no signs of mucus. With the light, I can see that there's no holes in her septum. And no deviated septum either. So if you would plug one nostril and breathe in for me, and do it on the other side. Perfect. And both of her nares have good patency. After her nose, I'm going to move down to her mouth. So I'm going to inspect first her lips, and her lips are a healthy pink color, slightly chapped, and no other sorts of lesions or lumps or abnormalities. If you would go ahead and open your mouth for me. And I'm going to inspect her gums, her hard and her soft palate, and her teeth. And her gums look good. a healthy pink color, no signs of gum disease. And she has all 28 teeth. That's good. Her tongue is a pink color. There's no signs of overgrowth or bacterial infection. And her mucosa is also a healthy coloration as well, like a clear white color. So then now I'm going to be palpating your tongue for any sort of lumps or masses. So if you would open for me. I'm not seeing any sort of lumps. No signs of oral cancer. So now I'm going to put my finger on one side of your mouth and you would just press up against it for me. Awesome. And then on the other side. Fantastic. And that's to test her tongue strength for cranial nerve number 12. If you would open up for me and say, ah, ah, and her uvula rises up, and that's to test for cranial nerves number 9 and 10. Go ahead and open one last time. I'm checking for her tonsils. And I can see her tonsils, but they're behind her, the pillars of her mouth, so I would rate that a 1. So now, if you would, I'm going to ask you to do some facial expressions for me. So if you would smile, if you would frown, blow out your cheeks. If you would close your eyes really tight, awesome, and then raise up your eyebrows. Great, and that's a test for cranial nerve number 7. So after that, I'm going after her mouth. I'm going to move to her neck. So I'm going to first inspect and make sure that it's symmetrical and linear. So it's sitting upright. There's no sorts of lesions or masses. Her thyroid gland cannot be seen. No sorts of pulsations. Then I'm going to palpate your trachea and make sure it's midline. And it is midline, and I could not palpate her thyroid gland. So then I'm going to move and do your lymph nodes. So I'm going to first go to preocular, and let me know if you feel any tenderness.
Okay.
Preocular, postocular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and then subclavicular. Awesome. And none of her lymph nodes were palpable. And did you have any pain?
No pain.
No pain. So that's awesome. That means that there's no signs of infection. So then after your lymph nodes, I'm going to be testing your range of motion of your neck. Okay? So if you would look all the way up and down to your feet, and if you would look left and right, and if you would take your ear and try to touch it to your shoulder without lifting your shoulder. Other side. Perfect. So then now I'm going to test it with resistance. So go ahead and move your face up against. Awesome. And then on the other side. Perfect. So she has no muscle weakness with or without resistance. No limitation to her range of motion. And was there any pain associated with that? And no tenderness. Then after her neck, I'm going to move to her upper extremities, her arms. So first I'm going to inspect, and I'm going to take note that she has a 3-star tattoo on her right shoulder, a triangular tattoo on her inner right arm, and then a 142 tattoo on her inner left arm. Other than that, she has slight minor scrapes, but other than that, there's no signs of other lesions or abnormalities. I'm going to palpate and be feeling for her temperature, which is warm. Her arms are dry. There's no lumps, masses. There's no edema. Any pain?
No pain.
So then I'm going to be feeling your shoulder joints for any sort of edema. Your elbows, your wrists, and then your fingertips. Now her fingertips are colder than her arms. So I would be checking for capillary refill to make sure that she is getting perfusion to her fingertips. But she has her fingernails painted. But I will be checking for clubbing and for any textures. And she has no signs of clubbing. So if you would go ahead and like move your shoulders like this for me, and then the other way. Awesome. And if you would shrug your shoulders, and that's a test for cranial nerve number 11. If you would move your arms like this for me. All right. And then now if you would do it against my hand. And this one. Oh, can you go like this for me? All right. She has a little bit of double jointedness in her elbows. Would you move your wrists around for me? Perfect. And then now against my hands. Awesome. And then fingertips, can you move them? Awesome. Can you do, it's a finger test, so if you would touch your fingertips like this and slowly speed up as fast as you can go. Perfect. And then now, put your arms on your thighs and rotate them like this slowly and then speed up until you can go as fast as you can. Awesome. So she has no limitation to range of motion with and without resistance. Then I'm going to go back and check for her brachial pulse. All right, got those two. And this one here. And got those two as well, so that's good. After her upper extremities, I'm going to move to her posterior thorax. So if you would turn around for me. Here's where I would inspect and palpate for crepitus, for temperature, moisture, any sort of lumps and lesions or abnormalities. And then I'm going to auscultate to listen to her lung sounds for 18 and 20 places. Breathe in for me. Breathe in for me. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, and 18. She does have a tattoo on her central back. Are you getting a bit cold? You got goosebumps.
I am.
So after I auscultate, I'm then going to perform blunt percussion for CVA to make sure that she has no issues with her kidneys. So let me know if this hurts, okay?
Okay.
Any pain?
No.
Now this side. Any pain?
No.
Perfect. So then after her posterior thorax, if you would go ahead and turn back around for me, I'm going to move to her anterior thorax. So here I'm going to inspect and palpate for temperature, crepitus, edema, moisture, dryness. I'm going to go and check her skin turgor to make sure she's hydrated. Perfect. And the skin retracts in less than 2 seconds, so she has enough water to drink. Then here I'm going to listen to her breath sounds for 8 to 10 spaces. Breathe in for me. Breathe in. 2, 3, 4, 5, 6, 7, 8, 9, and 10. After I auscultate and listen to her breath sounds on her anterior thorax, I'm going to go back and focus on the pericardium, her heart. So I'm going to inspect her jugular vein for any pulsations when the head of the bed is at a 45-degree angle elevated. And after that, then I'm going to inspect, auscultate, and palpate her carotid arteries for any bruise, but I'm going to do one at a time. After that, I'm going to listen to her apical pulse and count that, and I'm also going to be listening for heart sounds. After I do her pericardium, I'm going to then move down to her abdomen. So if you would lay down for me. So first I'm going to inspect her skin coloration. Her skin coloration is normal. It's a little bit more pale than the rest of her skin, but that's normal for the abdomen as it sees less sunlight than the rest of the body. It's symmetrical. Her umbilicus is symmetrical along with her sternum. Those are both midline. I don't see any sorts of lumps, masses, or bruises, any sort of other lesions on her stomach. I'm going to look at the contour of it and notice that her contour is flat. And then I'm going to listen to your bowel sounds. So I'm going to listen to all four quadrants to make sure that she's digesting. Awesome. And she has a good range of from 5 to 30 bowel sounds. So that's good. They're not hyper or hypoactive. So now I'm going to palpate and feel around your abdomen. So let me know if you feel any sort of pain, okay? Okay. Anything?
No. Nothing.
Awesome. So there was no, I didn't feel any sort of lumps or masses. So now I'm going to deep palpate to make sure I feel all of it in there. Any pain?
No.
Awesome. And again, no lumps, no masses. I don't see any sort of unusual discolorations like Grace-Turner's sign. So, awesome. That's good. If you would sit back up for me. So then after her abdomen, I'm going to move down to her lower extremities. So first I'm going to inspect, and I notice that you have 2 bruises on your right upper thigh. Do you know how you got those?
I've been building a set for a musical here, so
okay.
Lots of heavy lifting and moving and things. So probably from that.
All right, I understand that. And I notice that she has a scar down her right shin. And otherwise, from that, there are no signs of any sort of lesions or abnormalities. I don't see any lumps. So now I'm going to go ahead and palpate. Her legs are slightly chilled. They're dry. I don't feel any sort of edema or any lumps. Her hair distribution is absent. Do you shave your legs?
I do.
Awesome. So then her skin color is normal for her skin tone. No abnormal discolorations besides the bruises and her scar. So now I'm going to test your patellar reflexes.
Okay.
want them too. So her patellar reflexes are hyperactive. So now I'm going to go back and feel your popliteal pulses behind your knee. Okay. On this one. Then I'm going to move down to her dorsalis pedis pulse. And then her tibial pulse. Posterior tibial pulse, which is on the back of here. I'm going to do the same thing back to the dorsalis pedis. And then the posterior tibialis pulse. And then here I would check for capillary refill. Her toenails are painted, but no sign of abnormalities or discoloration. Her feet are a little bit more cold than the rest of her legs. So then now I'm going to feel your hips, your knees, and your ankles for any sort of pain or swelling, okay?
Okay.
Any sort of pain? Here?
No.
Here?
No.
What about in your ankles?
None.
And then this one?
No.
All right. So there's no signs of tenderness, no edema, no crepitus in her hips, knees, ankles. Here is where I would test her range of motion of her lower extremities. And then now, if you would stand up for me. Now I'm going to test for her spine. So if you would just stand right over here for me. And I'm going to ask you to just walk over there and then come straight back. Okay. So I'm observing her gait. She is walking upright. Come on back. She is walking upright. She is not struggling for balance. She doesn't have a limp, and her steps aren't abnormally too big or too small. I'm going to look at her spine from the back to make sure that there's no sideways curvature for a sign for scoliosis. And her spine looks linear. And then from the side, there's no abnormal curvature of her cervical or her lumbar vertebrae. So that's good as well. If you would go ahead and bend down and touch your toes for me. Awesome. And then I'm going to be looking for any abnormal curvature or abnormal flatness of her back, but I don't see anything. So thank you. If you would sit back up for me. Now, if you would stand back over here, and if you would walk heel to toe for me.
Okay.
So she's able to walk in a straight line. She is not struggling for balance. If you would come back this way. Awesome. So she's able to do that very well. So then now I'm going to do a thing called the Romberg test. So if you would close your eyes and stand still like this, I'm going to watch your balance, okay? I'm going to do this for 20 seconds. And she is able to maintain her posture. She's not struggling for balance. She's able to stand erect and upright without separating her feet to maintain her balance. All right, you can open your eyes now. So that would be a negative Romberg test. So then now I'm going to have you put one finger to your nose and then the other like this. And then start off slow and then start to speed up. All right, and she's able to do that. So that is also very good. So this was my head to toe assessment. You are cleared. I don't see anything wrong with you. So thank you very much.